This is a scan of a 60-year-old gentleman who came with complaints of pain in his shoulder since last 2 weeks. So, in the age of 60 years and complaints of pain, the first thing that we'll think of would be rotator cuff tear. But here we are seeing that on the sagittal PDFS images, the rotator cuff appears almost good. So there is no significant tear to cause such complaints. There is the expected tendinosis, which is usually seen above the age of 60 years. But the one thing that we should not miss is the changes of denervation. So on closer inspection, we'll be able to see that this supraspinatus, infraspinatus, and teres minor muscle bellies appear bright. There is no similar changes in the subscapularis or the posterior fibers of the deltoid. Here we can see that this hyperintensity is limited to these muscles. But these muscles are not supplied just via a single nerve, because here it is axillary nerve and here it is suprascapular nerve. So we need to think that there is multiple muscle group or multiple nerves involved. Here in the coronal images as well, we see that there is heterogeneity, there is some bright appearance of the muscle belly. As compared to that, we see in the subscapularis, it is homogeneous. So one more thing that we need to see is whether there is any fatty atrophy, because if there is any fat within, then also it will appear a bit like this. So on the T1 sagittal images, we see that there is no fatty atrophy within the muscle belly. So this would point towards a subacute denervation type of changes. So it could be representative of plexitis. So brachial plexitis is one of the cause which can cause this type of appearance in a patient who has been complaining of pain and no restriction of the movements. So don't ever forget to look at the muscle bellies even when everything else appears normal. Thank you.